Hi, my name is Dr. Jacob Kneeman, board certified pain medicine doctor. And in today's video, I'm going to discuss the different causes of arm and hand numbness and tingling. I made this video so that you could understand what's happening in your own body and explain it well enough that you would feel confident explaining these same concepts to a friend. If at least one person benefits from this information, then it will have been worth it to me. So here's what most people don't know, that tingling could be coming from 4 different places in your body. And if you treat the wrong area, you're wasting precious time while your condition gets worse. The scariest sounding problem in location, the one coming from your neck, actually has an 85% chance of healing completely on its own. Go ahead and like this video now and stick around until the end because I'm going to show you exactly how to figure out which one you have. Section 1, the nervous system highway. Before we dive into the specific problems, you need to understand what's actually happening in your body. Think of your nervous system like a sophisticated highway. Your brain is the control center, and these nerve highways carry 2 types of traffic: motor signals that tell your muscles to move, and sensory signals that tell your brain what you're feeling. When people say pinched nerve, here's what's actually happening. Imagine your nerve as a garden hose. When something steps on that hose, that's compression, the signal is trying to get through, but it becomes inefficient and doesn't. Mild pressure creates that kind of static like tingling you feel, but severe, prolonged pressure, that can cause permanent nerve damage, leading to weakness and loss of feeling that may never come back. This is why getting the right diagnosis early is absolutely critical. Section 2, Carpal Tunnel, the crowded subway. Let's start with the most common culprit, Carpal Tunnel Syndrome. This accounts for actually 90% of all nerve compression cases. Picture a risk like a busy subway tunnel that can't expand. 9 tendons and one nerve, the median nerve, all have to share this tight space. When inflammation occurs from repetitive use or poor positioning, something's got to give. And it's always the nerve. Here's your diagnostic cheat sheet. Carpal tunnel affects your thumb, index finger, middle finger, and the thumb side half of your ring finger. If your symptoms match this exact pattern, you're looking at a problem at the wrist. The dead giveaway? It wakes most people up at night. Most people curl their wrists when they sleep, increasing pressure in that already crowded tunnel. You also might wake up and shake your wrist to kind of relieve your symptoms. Your body is giving you an early warning. Do not ignore it. Section 3, Ulnar Neuropathy, the funny bone problem. Next, we move to your elbow, Ulnar Neuropathy, also called Cubital Tunnel Syndrome. This is your funny bone nerve. It runs along the inside of your elbow in a tight space called the cubital tunnel. Unlike the protective median nerve in your wrist, this nerve sits right under your skin. The symptoms are completely different from carpal tunnel. You'll feel tingling in your pinky and outer half of your ring finger. If your symptoms are on the outside edge of your hand, the problem is coming from your elbow, most likely, not your wrist. The trigger? Sustained elbow bending. Sleeping with your arm curled up, or spending hours leaning on your elbow at a desk. The good news is that this gives you immediate control. Simple positioning changes can often solve the problem. Section 4, Radial Tunnel, the silent imposter. Now, this is a tricky one, Radial Tunnel Syndrome. This is a condition that fools everybody, including doctors. The radial nerve passes through a collection of tight muscles near your elbow. When these muscles squeeze the nerve, you get deep, nagging pain in your outer forearm. Here's why it's the silent imposter. It causes severe pain, but almost never causes tingling or numbness. And it feels almost identical to tennis elbow, with the pain right around here. I've seen patients spend months treating tendonitis with anti-inflammatory drugs when really the real problem is the compressed radial nerve. If you have persistent outer elbow pain that hasn't really responded to the usual treatments for tendonitis, you might actually be dealing with this imposter syndrome. Section 5, Cervical Radiculopathy, or the pinched nerve in the neck. Finally, we get to the last source that we mentioned in the introduction, your neck. Cervical radiculopathy basically just refers to a nerve being pinched or irritated in your cervical spine. Think of your neck as the main highway hub. Every nerve going to your arm starts here. When a nerve root gets compressed right where it exits your spine, that's your bottleneck location. However, the key difference is that these symptoms start in your neck and shoot down your arm like an electric shock, often starting up here, going into the arm and shoulder, and down to the forearm, and sometimes the hand and the fingers. It's often described as sharp, burning, or lightning like pain that travels from your neck all the way down. But here's the reassuring news I promised: over 85% of brand new cases heal completely on their own within 8 to 12 weeks with conservative treatment. This should prevent panic and give you some hope. Section 6, your diagnostic cheat sheet. Let me give you the ultimate cheat sheet to map out your symptoms. Thumb, index, middle finger, plus thumb side of ring finger at night basically equals carpal tunnel. Pinky, ring finger, plus elbow bending often at nighttime equals compression of the ulnar nerve at the elbow. Deep forearm pain plus no tingling equals radial tunnel syndrome. Neck pain shooting down the arm essentially equals cervical radiculopathy. These specific patterns transform your vague symptoms into concrete information you can use with any other healthcare provider. Now you may be wondering, what else can I do if the symptoms are overlapping or it's not exactly fitting any of these pieces that you've mentioned, Dr. Kneeman? Well, there is a test called an EMG or electromyography. And this test specifically tests the nerves in the neck and the arm. And oftentimes it can help figure out where the nerve problem is happening. So if you're still confused by your symptoms and you're not quite sure, talk to your doctor. And if your doctor also needs help, consider ordering this test to figure out exactly where the nerve issue is. So now you have the knowledge to identify what's causing your symptoms and speak confidently with your healthcare provider about where your problem is coming from. If this evidence-based breakdown helped you understand your symptoms better, hit that like button and subscribe for more practical pain management solutions that actually work. And if you know someone struggling with hand numbness or tingling, share this video with them. They need this diagnostic cheat sheet. For those wondering about ways to improve your daily habits to help with pain and flare-ups, check out my next video. It might be exactly what you need.